Just a quick update for anyone who's on the other end of these cameras. We'll probably be starting about 10 minutes late. Thanks.
Stand by. This is 1 minute warning.
Hey, Josh, good afternoon. Good afternoon, ladies and gentlemen. My name is Nirav Shah, and I am the director of the Maine Center for Disease Control and Prevention. I'm joined this afternoon with Governor Janet Mills, Commissioner Jean Lambrew. We'd like to provide an update on the COVID-19 situation across the state of Maine. And today's update starts on a somber note. Maine CDC is aware of the passing of a woman in her 70s from York County who passed away with coronavirus. As always, our thoughts go out to the families of this individual during this time of mourning and grieving. Overall, Maine CDC is aware now of 734 cases of coronavirus, an increase of 36 cases since yesterday. The bulk of these cases remain in Cumberland County. Overall, 124 individuals have been hospitalized at some point during their coronavirus illness. And at present, 37 individuals are hospitalized in regular hospital beds, 21 are in intensive care units, and 9 individuals are on ventilators related to their coronavirus illness. This is, again, an important reminder that each and every one of the cases that we talk about are, in actuality, individuals with families, friends, and communities. And our primary goal is to wish them and help them along the path to a speedy recovery. With the inclusion of the latest individual who passed away, Maine CDC is now aware of 20 deaths statewide related to coronavirus. In addition, 292 individuals have recovered. And since the beginning of our activation, Maine CDC epidemiologists and clinical staff have fielded 4,751 consultation requests. I'd like to provide a brief update on 3 facility-level outbreaks that Maine CDC staff have been working on. The first involves the Tall Pines facility in Waldo County. There are currently a total of 24 cases associated with Tall Pines, 19 among residents and 5 among staff. The next is the Maine Veterans Home in Scarborough, where there are a total of 38 cases of coronavirus split between staff as well as residents, an increase of 6 since yesterday. And the third is the Augusta Center for Health and Rehabilitation, where there are a total of 63 cases of coronavirus associated with that facility, an increase of 8 cases since yesterday. I'd like to turn next to an update on our laboratory in Augusta. One of the top priorities of our laboratory right now is to assist facilities with rapid testing of individuals who have or may have coronavirus. In connection with that, our laboratory is preparing kits that can be distributed across facilities to make sure that those swabs that are necessary can be done appropriately, quickly, and sent to our laboratory in Augusta. Overall, our laboratory continues to be able to conduct tests and return results within approximately 24 hours, and there is currently no backlog of any tests. And overall, our testing capacity at the Maine CDC lab remains at approximately 3,000 tests. That being said, we are aware of challenges in obtaining reagents, the chemicals that conduct the test. We are aware of those challenges in the supply of those reagents at a national level, and our lab team continues to order more supplies to make sure our testing capacity remains robust. I'd like next to provide an update on our shipments and deliveries of personal protective equipment across the state. As a reminder, personal protective equipment of all sorts is worn by healthcare providers in order to help them stay safe and guard against coronavirus. PPE, as it's known, has been a scarce resource nationwide, and one of our tasks at Maine CDC is to distribute PPE across the state in a fair and equitable fashion. Yesterday, Maine CDC staff, working with our colleagues in the Department of Transportation, filled 116 orders for PPE, comprising 67,000 total pieces. To put that in perspective, that is 5 full cargo vans of PPE that were shipped in concert with our partners at DOT just yesterday. Of the 116 orders, about 2/3 of them went to congregate care facilities, such as nursing homes, and other congregate care facilities that we know are at high concern and high risk for outbreaks. I've got the breakdown on what we provided, and we're happy to provide that to anybody, but at a high level, we shipped out close to 4,000 N95 masks, over 26,000 surgical masks, 4,600 face shields, almost 28,000 gloves, over 400 protective suits, and about 4,500 surgical gowns just yesterday alone. Our work on that distribution is continuing. Today, Maine CDC staff, again working with our colleagues at the Department of Transportation, are shipping out 30 orders for PPE. Similarly, the bulk of those orders are going to congregate care settings, such as long-term care facilities, nursing homes. Since beginning our work around coronavirus, Maine CDC has filled 832 orders for PPE, comprising the broadest swath of healthcare, first responder, and other institutions across the state. And I'd just like to take a second to thank the staff within the Department of Transportation and our Public Health Emergency Preparedness Program for pulling, packing, and shipping these orders as quickly as possible so that we can keep frontline healthcare workers in the job caring for Maine people who could be at risk for coronavirus. I'd like to now turn things over to Governor Mills for her updates. Thank you, Governor.
Thank you, Dr. Shaw, as always, for your compassion and your intelligent delivery and aggregation of the facts and medical science, because everything we're doing, every step we take in the face of this pandemic is based on fact, medical science, and the experts whom we've brought together, including Dr. Shaw, of course, and our Commissioner of Health and Human Services. You know, I want to take a moment to thank all the people of Maine. We go back a long ways, you and I. And for generations, resilience has defined the character of the Maine people, newcomers and old-timers alike. Not that I remember this event, but my parents would tell me about how in March of 1936, the year of the Great Flood, heavy snow and rain overflowed the Androscoggin River, wiping out roads, ruining businesses, destroying homes all over. And Maine people paddled canoes and boats and down these submerged streets, evacuating stranded neighbors, taking them to higher ground. In October 1947, the year Maine burned, as it was called, fires raged through 250,000 acres of our forests. It razed 9 towns, and left thousands of people homeless. When fires blocked the roads, Maine fishermen evacuated hundreds of people out to sea, by sea, to a neighboring village. And then in January 1998, something many of us remember, the ice storm, the surprise ice storm, plunged a 500,000 Maine people into darkness and into cold for weeks at a time. A Maine lineman working around the clock to restore power remarked in a newspaper, quote, "People were incredible. It's different in Maine than it is probably anywhere else. People are resilient. They pull together," the lineman said. So time and time again, Maine people have risen to the challenges that confront us. We have survived fire and flood, ice storms, and most recently, April's snow and rain and heavy winds and power outages. Faced with this new challenge of COVID-19, Maine people are once again pulling together, even as we stay apart. Retired teachers in Portland are sewing masks for healthcare workers on the front lines. Yarmouth created a community coronavirus task force, and they established a call center for residents. They arranged for grocery pickup and delivery for those people who cannot get to the store. They created a network where volunteers can keep tabs on other people in their neighborhood. Monmouth Academy, the track and field coaches, are delivering bagged breakfasts and lunches to make sure the kids are fed. Pineland Farms Potato Company is giving out 5,000 free boxes of food across the county. And LL Bean and Origin and New Balance are sewing masks, turning to and providing some of that PPE to people across the state. And just the other day, Pender Macon from the Department of Education, our commissioner, gave out 500 iPads, laptops, hotspots to kids in Piscataquis County so that they can be part of the community again, so that they'll stay connected. They will continue to learn and be able to speak with their friends over the internet. And we're doing the same in Waldo County and other counties to come, thanks to the generosity of Maine donors and to the hard work of the Department of Education and the schools across the state. These are just some of the ways that Maine people have stood up, stepped up, just as we have in the past. We're rowing each other ashore, keeping ourselves from drowning. These are more than random acts of kindness. They are lifelines, community lifelines for thousands of people. I know there will be difficult days ahead still, days and weeks before us, but I'm confident we will continue to deal with this challenge with toughness and resilience and ingenuity, and we cannot let down our guard. That is why today I've signed a proclamation extending Maine's civil state of emergency for another 30 days through May 15th, 2020. The original state of emergency proclamation would have expired tomorrow. This means I retain the emergency powers. It doesn't mean that every single emergency order will necessarily stay in effect, but will have the power to remain as long as they are necessary through the next 30 days. I sure wish that this proclamation were not necessary, but the continued spread of this deadly virus demands our sustained response. A state of civil emergency, continuing state of civil emergency, keeps Maine on high alert and allows me to deploy all available state resources to protect the health and safety of Maine people and to swiftly respond to and protect against the spread of COVID-19 in Maine. It also eases Maine's access to critical federal aid. And for now, I continue to urge Maine people to do their part and stay apart. It is the best way and the only way we will defeat this virus and protect the state that we all know and love. So stay the course, folks. Stick with us here. You're saving lives, hundreds of lives, by staying home. and I know it's a test of patience. But don't forget to hug your kids. Tell them to keep a journal, maybe. Write down their thoughts during the day and the evening before they go to bed. Keep those thoughts so that years later they'll look back and they'll say, that's how I felt. I remember now feeling that way. They'll know how they grew, how they learned, and how lucky they were to live in the great state of Maine. Be patient with your kids. Be patient with your partner, your family members. Be patient with your neighbors. Be patient with yourself. And give yourself a hug once in a while. And remember, we are all working day and night to keep you safe every hour, every day. So God bless you and keep you safe. And God bless the state of Maine. I believe we have some questions.
Great. Thank you, Governor. Yes, we've got some questions from our colleagues in the media, and we'll start with Steve Betts from the Courier-Gazette. Go ahead, Steve.
Yes, thank you, Dr. Shaw. This question is for Governor Mills.
Yes, Steve.
Yesterday, President Trump said he has the authority to decide when states can ease restrictions. Do you agree with that assessment? And will you be working with other governors in the region to decide when Maine will reopen?
Thank you for the question, Steve. He asked, I guess they can hear it, but he asked about President Trump's statement last night. It's hard for me to keep on top of all the statements coming out of the White House, and I don't write them down. I don't respond to them. I don't think it's necessary for me to respond to them. I am working with other governors. I was on a call for an hour and a half yesterday with the Vice President and with Dr. Birx and FEMA Director Gaynor and others, and 50 governors. And we had a vigorous conversation about how we can keep working together, how we can access more test materials and test kits, how we can distribute PPE and get as much as we can, how we can deal with nursing home. Am I going too fast? With nursing home and congregate living situations. And we're working together as a team. And I've been in close contact with the governors of Vermont and New Hampshire because they're at about the same level we are per capita in terms of the number of cases, number of deaths, although Vermont is a little bit different because of their population. But we all have the same kinds of emergency orders in effect. In fact, Vermont has some extra orders that we don't have here. But we're working together because I figure, look, we share Route 2. We share truck routes. We share industries, agriculture. We share the economic foundations of our states. We share the Appalachian Trail, the Green Mountains, the White Mountains, and the 100-mile wilderness, Mount Katahdin and Baxter Park. We share a lot between New Hampshire and Vermont and Maine. And economically, we are similar. And so those are the people I'm dealing with most closely. And we are talking about how and when to lift any restrictions that are appropriate based on the medical evidence, the public health and safety criteria that we all want to apply, and how we can gradually turn things around when it's safe to do so.
Thanks for the question, Steve. Next question goes to Amy Brown from WERU.
Thank you, Dr. Shah. First, for the Governor Mills, that extension of the civil emergency, does that also extend the stay-at-home order? And then for Dr. Shah, I have a follow-up question, if I could.
Thank you, Amy. The stay-at-home order was already extended, I believe, till the end of this month, and it is subject to review and renewal if appropriate.
So that's not extended until May 15th, along with the civil emergency?
Not yet. The power to extend it is extended.
And go ahead with your follow-up, Amy.
Okay. It's about asymptomatic people who have tested positive. Will all of those folks eventually develop the COVID-19 illness? And If not, can they continue to spread it while they're asymptomatic, or do they eventually develop antibodies? How does that work?
Okay, so great questions, Amy. Amy's question is about asymptomatic people and whether they go on to develop full-blown COVID-19. And Amy, it's a great question, and there are two categories here we have to keep in mind. One category is asymptomatic. That means people who might have the disease and never show any symptoms. The other category, which is similar but different, are pre-symptomatic people. People who have the virus but just haven't yet developed symptoms. There's a lot of research that's going on right now to try to determine what percentage of everyone who gets exposed to the virus is completely asymptomatic versus pre-symptomatic. The best data that we have comes from a somewhat gruesome source, which is some of the cruise ships that we've seen in the news around the world, where a large number of people have developed the disease. And some of the studies that have been done on those cruise ships suggests that in some cases, about 1 in 5 people who have COVID virus in their body don't develop symptoms, and that another 20 or 30% can get tested early, but then later go on to develop symptoms. So, Amy, the critical thing there is to distinguish between asymptomatic and pre-symptomatic. Similar sounding, but in terms of the science, as you can see, somewhat different. And then in all cases, based on what we know about the science, Amy, is that each of those categories of individuals should go on to develop protective antibodies, but there's a lot more science and research going on about when that happens and how that happens. I'd like to turn next to Isha from the BDN.
Hi, can you hear me?
Go ahead.
Hi. So my first question is a follow-up for Governor Mills. You just said that you have been in contact with other governors to discuss the reopening of the economy. What is the nature of this planning, and what do you expect to come out of it, and when? And my second question is for Dr. Shah. The IHME model predicted that today is the peak for hospital resource use in Maine. Do you agree that we're at the peak in terms of our hospital resources? And what if that is the case, what does it mean for the alternative care facilities?
Oh, that's a good question that sort of leads back to the first, because what we do in terms of turning the economy sort of back on, not like a spigot, but as Dr. Shah likes to say, going back downstairs, going upstairs slowly, gradually, taking one step at a time, depends on the public health criteria, depends on medical science. How soon will it be before we lift the stay-at-home order? How soon will it be before we allow certain businesses to open more widely? That is really, it's the question of the hour, and I cannot answer it, because we're taking it day by day, hour by hour. And that's what all the governors in our area are doing. We're talking a lot. We're talking about whether or not construction can begin again in Vermont, although we've allowed construction to continue in Maine. We're talking about how crews can work together, what best practices we should recommend or impose when certain businesses do reopen, because no question about it, we will be required to keep in place some physical distancing limitations, requirements, and some other public health measures. So we're taking it one day at a time. I'm sorry I don't have a more definite answer for you. A lot depends, again, on testing as well. The more test kits we get, the better able we will be to allow more people to go back to work in different areas.
So, Isha, as to the second part of your question, I'll start and then turn it over to Commissioner Lambrou for the ACS piece. But it speaks to one of the reasons why, when we do our modeling, we don't rely solely upon any one type of model. The IHME model is just one of different types of models out there. It's closely akin to trying to figure out what the weather tomorrow will be like by pulling the almanac off the shelf and seeing what the weather was like last year. It's impossible to know at any one time whether we are at the peak. But the focus of our modeling work, the reason we do modeling, is not to predict when we might be at the peak, but to plan for what resources we might need whenever that peak happens, whatever it might look like. We may not know for several weeks, several months, whether today was the peak or was not the peak. In any outbreak, you really only know that in retrospect. What I can tell you is that no matter which scenario we happen to find ourselves in, we at the state of Maine are ready for that from a resource perspective. One of those resource perspectives is the alternative care sites. I'll turn that over to Commissioner Lambert.
As we previously announced, we have been working with the County of Cumberland, City of Portland, and the City of Bangor, as well as Penobscot County, on 2 alternative care sites in those locations. We have, since that announcement, identified uses for those sites. In the Portland area, it would be for people with COVID-19 who don't require intense care, post-acute care, people who can't go home, who can't find a different placement. In Bangor, it would be people who do not have COVID-19, people who you want to keep out of a healthcare setting to avoid any potential infection. So we've identified the uses. We've also begun to deploy beds. So we have moved 100 beds to the Portland area. We're staging those beds. There will be at least 50 beds in the Bangor area, and we are very close to finalizing staffing plans. That said, as Dr. Shaw said earlier, as of today, there are 21 people in critical care beds in the state of Maine. There are 58 people total hospitalized throughout the state of Maine. And when we do our daily check on resource availability, we have 163 critical care beds available. We also have over 283 ventilators available. Again, 9 people are using ventilators today for COVID-19 confirmed cases, and we have 283 available. We prefer to care for people in hospitals. We have high-quality hospital staff, high-quality hospitals, and our goal is to keep people in hospitals wherever possible. We would only go to alternative care sites should we need to, but at this moment, we don't think we need to stand them up this week. So we continue to plan. We will get those plans refined and ready to go, but at this moment, we see no need for them today.
Thank you, Commissioner. And we will turn next to Megan from WMTW.
My question is for you, Dr. Shaw. Do you keep track of suspected COVID-19 cases, perhaps of people who haven't been able to get tested, or their physician has said, no, we don't want to test you, go home and quarantine? Because we obviously know that there are more cases out there. We just haven't had them, quote unquote, confirmed. Do you keep track of those?
So Megan's question is about, in an outbreak setting, how do we know how large the iceberg totally is? And what do we do in terms of reporting and keeping track? So 2 observations there, Megan. The first is that one of the pieces of data that we ask hospitals to report to us are not just the number of confirmed patients with COVID-19, but also those that the hospital suspects to have COVID-19. I don't report those numbers out every day because it turns out to be a lot of numbers all at once, but we have those numbers. We can get you today's numbers, for example. So we do ask hospitals to report that to us based on their clinical suspicion. We also, however, know that in at least 3 counties in Maine, community transmission is occurring. First in Cumberland, then York, now Penobscot counties. And what that means is that COVID-19 is akin to the flu. It's all around us. It's everywhere, not just in particular zones. What that also means is that some clinicians may not take the step. They may decide that, we're not sure whether the respiratory illness you have is the flu, another virus, or COVID virus. we're just going to treat you as if it were one of those three and ask you to stay home and take care of yourself. In those situations, clinicians are not required to report that as a COVID-19 case to the Maine CDC. They are certainly allowed to, but what we require reporting of are laboratory confirmed cases so that we don't have that confusion about whether any case was influenza, COVID, or another virus. Thanks for that question. And we will turn next to Dan Newman at the Maine Beacon.
Hello. Yeah, I have one question for Dr. Shaw and one for Governor Mills, if you'll allow me. Dr. Shaw, I understand there's an ongoing conversation about universal testing in nursing homes. Would that also be helpful in prisons and jails where people are also being held in congregate living? Can you say more generally about what testing regimen there is for people in confinement in Maine? It appears the Department of Corrections has only tested 17 inmates so far. Secondly, Governor Mills, are there any policies being advanced to move more people to community confinement or thin the prison population? Thanks.
I'll start the first piece, Governor, if that's all right. So, Dan, you are correct that based on our morning briefing, we're aware of 17 individuals at the Department of Corrections who have all tested negative for COVID-19. Now, with respect to the exact protocols the Department of Corrections and their medical providers follow, I would refer you to Corrections just so I don't get any of the facts wrong. But generally speaking, they follow the US CDC's guidelines with respect to whom to test. But for the specific nuances, again, in order to make sure I don't give you anything incorrect, I would refer you to Corrections. And then as to the latter question, Governor Mills.
Thanks, Dave. Yep. The Department of Corrections has been assessing a lot of different inmates in the state facilities. They have released, I believe, last count, 63 people out of the state facilities into what's called supervised community confinement. That is, they have a place to go to, a place to stay, because we do have this stay-at-home order. Beyond that, I am not issuing commutations widely or anything of that sort, and we're taking it step by step. The department is basing its decisions on who's eligible for supervised community confinement based on risk to the public safety, first and foremost, and length of time left on the person's sentence. Those two things have been the primary criteria for those release decisions.
Thank you for that question. We'll turn next to Don Kerrigan at News Center. Go ahead, Don.
Thank you very much, Dr. Shaw. A couple of questions regarding long-term care facilities. First of all, I believe the threshold for testing people in one of those facilities, requiring everybody to be tested, is 3 cases to make an outbreak. Are you looking at reducing that threshold and testing the whole place if even one case shows up, given how rapidly cases have spread in these 3 homes? And secondly, are you anywhere near a situation where you might need to find other places to move healthy nursing home patients if the outbreaks get too big?
Great. Thanks for those questions, Don. Don, your first question is about how we think about testing in long-term care facilities, nursing homes. It's important, this is something that has been top of mind for us for quite some time, and more intensively just in the last week or two as we've been thinking and reviewing data from other states. One of the things that I'm proud of is that Maine was really, just based on a call I had last night with my counterparts from the other 49 states, Maine really is one of the few states that has already instituted a policy of universal testing across the country. There are other states that are contemplating how and when to follow the lead that Maine has already taken, and I anticipate other states will do so. But as I was chatting with my colleagues last night and talking about how we've already moved toward universal testing now in 3 facilities, that was news to them, and so it's something that we've been thinking about based on our review of the data. The approach that we've taken as a starting point is when there is an outbreak. An outbreak is defined by any 3 individuals, be they staff or residents, who are epidemiologically connected in some way. In this case, because they are either staff or residents of the facility. That's where we started the conversation. but it may not be where we end it. The reason we started there is that although we are aware of at least right now 3 facilities in Maine where there are outbreaks, and although we anticipate the likelihood of more, we're similarly aware of other facilities where there have been 1 case that did not flare up into an outbreak. And that's a good thing. It's a testament to the fact that rapid intensive infection control practices can prevent 1 case into turning into more cases. So the question for us is, how do we square those 2 things? And we're actively reviewing. In fact, just this morning, I had a pretty long and intense call with our top 2 medical epidemiologists at Maine CDC to debate how and when and whether we should move our threshold from 3 to 1. Recognizing, Don, that the time between 1 and 3 may not be that long. And so in practice, we're not talking weeks and weeks, but also recognizing that we also have a limited number of testing supplies. So we've got to balance all of those things all at once. As I've said before, our decision on this will be motivated by 3 things. 1 is making sure we do what's best for the men and women who live in and work in these facilities. Number 2, science. What do the data tell us about how transmissible this virus is across facilities? And number 3, transparency. We want to be clear with everybody about what our standards are. We are currently evaluating this. No final decisions have been made, and we'll continue to evaluate it because that's how we do things in a scientific fashion. Thanks for that question, Don. And we'll turn next to Steve Missler from Maine Public.
Thank you, Dr. Shaw and Governor Mills. Quick clarification for the governor just on the conversations she's been having with the governors from New Hampshire and Vermont. Is this separate from the consortium that Governor Cuomo has been talking about, or is it sort of part of that initiative? And then a question for Dr. Shaw is about yesterday, Dr. Birx mentioned, I think during the White House briefing, that the feds are looking for sort of an inventory or census of testing equipment, including Abbott testing equipment, not the new rapid testing, but the Roche and Abbott platforms that can do actually more testing, maybe not quite as fast. I guess my question is for Dr. Shaw is whether or not we are participating in that inventory, and if we are, if you could provide us some numbers about what the state's capacity is on those platforms.
It's one of many, many, many things, one of many data points that the feds are asking for us daily, I might say. On your first question, Steve, the conversations I'm having with the governors of Vermont and New Hampshire are separate from what New York, New Jersey, Connecticut, Rhode Island, I guess Massachusetts are doing, and what the West Coast states are doing, Oregon, California, Washington, I guess. I think we have a more shared environment and a shared economy. We share a lot more things culturally and economically than with those 2 states than we do with the other states that you've asked about. We have rural economies, we have dispersed populations, we have a tourism economy, and all those things that we know we need to rejuvenate. We know we need to get back into the game. It's quite different than trying to turn the spigot back on in New York City or Providence, Rhode Island, or Stamford, Connecticut. Quite different. But at the same time, all 50 governors are talking. We have calls twice a week, once with all the governors, just the governors, and a very frank, candid conversation among us about what we are doing, sharing information and practices, and what we'd like to be able to do. And then secondly, with the vice president, sometimes joined by the president. That conversation occurred yesterday for an hour and a half. So.
And Steve, in terms of your the question, we are aware of the request from Dr. Birx in the White House to help get a better sense of the inventory. They're requesting information on 2 particular pieces of Roche diagnostic equipment, the 8800 and the 8600. So we are participating in those surveys for them. And when getting them the data we've got, we can get you the exact numbers of what we've got here in Maine, but we are participating and we're aware of that request. Before I go to the next question, I'd like to go back to Don Kerrigan's question just for a moment. There are two important pieces about our response to facilities when we are aware of a case. So Don, you asked about testing, but I should make very clear what Maine CDC staff do and how they jump into action as soon as we get notified of a single case at a facility. So as soon as Maine CDC is notified of a single case at a facility of any type of congregate living, they immediately rocket to the top of our list for any PPE needs. We also put them in touch with necessary technical assistance resources from an infection control, epidemiology, and if needed, public health nursing perspective to help them utilize that PPE, to help them cohort patients and help them keep track of any new illness. That happens as soon as we detect even a single case. So we don't wait for 3 for those other really important technical pieces. And that's one reason we've had a lot of facilities in Maine who have had 1 case and no more than that. And Steve, we'll get you the data with respect to the Roche 86 and 8800s. I'd like to turn next to TJ Tremble from WVII. Go ahead, TJ.
Governor Mills.
Hi.
Governor,
Yes,
how are you?
I'm good, thank you, TJ.
What are the benchmarks, if any, that would move you to lift the stay-at-home order at this point?
That would be, again, based on public health data and the advice of medical professionals, including Dr. Shaw, and our various commissioners, including Commissioner Lambrou, who's here today. It would not simply be based on the time of day, the time of month, the time when we usually open this or usually open that. It would be based solely on when is it safe to reopen a particular industry or reopen a particular community or area. When is it safe to ask people to come back out of their homes and to go to the theater again, or go to the parks again, go to the beaches again. It's purely based on public health.
Can you say what those numbers are that will indicate that things are safe in a community at that point?
Well, again, a lot of it depends on expanding testing as far and wide as we can, because testing will tell us whether the virus has spread. The numbers that Dr. Shaw presents every day, when we say it's new cases, it's really new test results as opposed to new cases. The cases are out there. We just haven't documented all of them, confirmed all of them. It is everywhere. We have to assume it is everywhere. So until we get over that huge hump of knowing that it is gone, that it has subsided, and I don't know the data point that makes that determination, but we'll decide that together.
Thank you.
Thanks for that question, TJ. Next up is Brad Rogers from WGME.
Yes, Dr. Shaw, as you've noted today and yesterday, a lot of the PPE is going to long-term care facilities. At those facilities, was there a shortage of PPE at the 3 long-term care facilities where we had the outbreak? Was there a shortage? And were they wearing the PPE, the staff, were they wearing the PPE that they necessary?
Brad, candidly, I think I would ask you to check in with those 3 facilities to get a better sense of any shortages they were experiencing as well as their utilization. What we do as soon as we are made aware of even a single case of any kind of any type of COVID infection is we essentially have a go pack that's ready to go, that starts the facility off with a minimum of 72 hours. Because we know that in any situation where there is a single case of COVID-19, the demand for PPE amongst the staff, the use of PPE by the staff needs to go up significantly. So we are immediately poised to dispatch at least 72 hours, which happens to be, according to the federal government, the amount that any facility should have on hand at day 1. After that dispatch is made, we start working with them to gauge what their needs are for the next 2 weeks. And that is, of course, always in flux based on the number of staff, the number of residents, how they are able to move patients into one wing safely and keep them separated from other unexposed patients. So it varies greatly by facility, and it really is a testament to the work that our epidemiologists and our infection control team do, because each and every facility is different. I'd like to turn next to Kevin Miller at the Press Herald.
Yeah, thanks, Dr. Shaw. One just a clarification question first, and then a broader question. On the clarification, obviously we saw a few more tests, a few more positive confirmed cases at the long-term care facilities. Is that because you're doing testing every day, or can you just tell us how often you're doing testing that would reveal these additional tests? And then the broader question about long-term care facilities. Have your gumshoe epidemiologists been able to kind of nail down where some of these cases originated from? For instance, was it a contractor coming in, or a technician that floats from numerous different facilities may have brought it in and exposed people?
Sure, that's two great questions, Kevin. And in connection with the questions that Brad raised a moment ago, I just want to pause very quickly and note that we talk a lot about facilities and institutions and places like that, but I think this is a good time to remind everybody that what we're really talking about are homes for our spouses, our siblings, our parents, and these are homes that are staffed by men and women who are going into areas we know that are highly affected by COVID-19, and I just want to thank them again. I ask that the next time everybody calls their mom, if your mom happens to live in a long-term care facility, ask your mom to pass the phone to the caretaker who provides for her care, because that person keeps showing up for work, and I think we all owe them a thanks. Kevin, to your specific question about where some of these new numbers are coming from, with a lot of facilities, especially the two most recent ones with whom we've been working, the Augusta Center for Health and Rehabilitation and the Maine Veterans Home, they were testing staff as they've come on service, as they've come on shift. So many of the new increases that we've seen, though not all, but many of them are in staff members who perhaps hadn't worked for a couple of days and showed up for their first shift on Saturday or Sunday and got tested, and then those tests got shipped to our laboratory in Augusta. That accounts for many of them, again, though not all. And Kevin, your question, it presupposes something that actually you and I talked about yesterday, which is if we do move to universal testing, there are some challenging questions that we have to make sure we think about first before we go in that direction, rather than go off half-cocked and just do something without a full plan. And chief among those questions is, how often should we repeat testing on individuals who are negative? That's something that my team and I are thinking about really intensely right now. And before we move in any direction around that, we want to think it through to the end game and not just make an announcement without having thought through the implications. For example, how long and how often should we retest people? So, Kevin, to your point about whether our disease detectives have determined where some of these infections were introduced, we haven't found that entry point quite yet, but that is one of the things they're working to piece together. Next question goes to Brian Sullivan from WABI. Brian, go ahead.
Okay, thank you, Dr. Shaw and Governor Mills. My question would be, first, I believe the initial order, this one's for you, Governor, the initial order when it was put in place, real estate agents weren't allowed to operate, but then they made a case and then were eventually able to, they found a safe way to go about their business and were able to then conduct business. Do you take us through a process in which a business that is currently deemed non-essential could make their case and reopen while this order is still in place?
Sure, great question. How can a business that's so sort of non-essential make its case to somebody in state government to be able to do business in some way that still protects the public? And we've made that determination in a number of cases, generally by Heather Johnson, Commissioner Johnson, taking in the issue, the complaint, analyzing it, talking with me and others. and issuing a letter saying that, because of what you've told us, we think you can do business or do business in this way or that way. We've done that with respect to a lot of retail operations. And the thing is, if you're an insurance agency or an auto dealer or a law firm or a bookstore, there are ways to do business without inviting the public into your store as you always have in the past. There are ways to take orders by telephone. There are ways to transact real estate business remotely. It's difficult, granted, but it is possible. And people are doing that. They're being creative. Auto dealers are advertising on TV that will take information by phone, will deliver the vehicle to your home, all those kinds of things. Bookstores are taking orders by telephone and then either dropping them off on your curb or leaving them at their curb for you to pick up. Things like that. Ways to stay in business and stay alive and keep people active in some other way other than congregating in the store, keeping physical distance and the like. So,
Dr. Shaw,
go ahead.
are we getting, with these 3 locations, the congregate care facilities having spikes in cases, is there any thought that the makeshift hospitals at the Cross Center in Bangor or Cross Arena in Portland might become activated or a necessity?
Brian, again, at all times, all options remain on the table. But based on the numbers that Commissioner Lambrou noted earlier, where we are right now is such that there is capacity within the healthcare system, within the existing number of hospital beds. So we're always looking at these data points each and every day. But of course, we always have to be concerned that moving individuals from their homes to a new location could pose potential risks as well. So we're always thinking about these things, but recognizing that there's already capacity within the healthcare system. Right now, our preference is to keep folks within the healthcare system, within hospitals, and within their homes. I'd like to turn next to Kate Koff from the Ellsworth American.
Thank you, Dr. Shaw, Governor Mills, and Commissioner Lambrou. My 2 questions, the first directed at Dr. Shaw and the second at Governor Mills. My first question is, Maine has thousands of seasonal farm workers, many of whom live in congregate facilities during the growing season, which will soon get underway. And I'm wondering, Dr. Shaw, what plans the state is putting in place to protect those workers and subsequently, protect the harvest. And then my second question is for Governor Mills, and we have a question that came in from an elected official in our area who is wondering what the governor is doing to connect with local city and town leadership in planning and decision making.
Governor, I'll let you.
With respect to the first question, I think I can say that the federal government has not opened up the H-2A program that allows agricultural workers from out of country to come here and to help with different crops. They haven't given us any guidance on that yet, as far as I know. We will let you know when they do, if they do. Secondly, I've had several calls with mayors of the cities across the state. Had one last week, the Mayor's Coalition, and I've had, actually 2 calls with municipal officials separate from the Mayor's Coalition as well, where we've talked about what's going on the ground. They report to me, I report to them, so we've been in touch a fair amount. Does that answer your question?
Yeah, I think so. Thank you. And so you said the H-2A, I guess I've read conflicting reports about this, but just to clarify, the H-2A visa program is not, we don't know whether we'll get those workers this year.
We have not received anything from the federal government that indicates one way or the other whether that will be activated.
Okay, thank you.
Great. And next up is Kit Harrison from Amjumbo, Africa. Go ahead, Kit.
Hi, Dr. Shaw. This question is for you. Okay, you said before that health equity informs all decisions at the Maine CDC. And last week you shared your concern about some stark data from Chicago, Detroit, some other cities that indicate that fatality rates from the COVID virus are much higher among people of color than others in the U.S. You also said we haven't yet seen those disparities in Maine, which makes it sound like the CDC is tracking cases by race in Maine. What does the data show here?
So Kit's question is about what we've seen in our data with respect to any racial inequities or disparities. And Kit, you're correct. One of our guiding principles in public health generally, and certainly within the state, is keeping a sharp focus on health equity at all times, whether that's in an outbreak setting or a non-outbreak setting. And as we've seen from other cities and states, there are highly disturbing trends that are beginning to emerge with respect to the disproportionate impact that COVID-19 has on poor and minority populations. We haven't really seen those trends emerge yet in Maine, but it's important to note that those trends really only emerged in other states and cities when they had multiple thousands of cases. Right now, sitting where we are, it is really too early to draw any trends or any conclusions about disparities, whether they be by race or socioeconomic status. In New Orleans, in Chicago, in Detroit, those trends only emerged after they saw several thousands of cases. So while we are keeping an eye out for those, we don't have a sufficient sample size at this time to draw any conclusions one way or the other. Let's hope we don't see those trends replicate themselves in Maine. But as I've said before, hope's not a strategy in this situation, and we're going to continue looking at the data. That's all the questions we've got for today. Thank you all very much for joining us. We look forward to talking with everyone tomorrow.
Thank you all. And I will just say one more time, I repeat myself, but it's worth saying again, stay the course. Stay home, stay apart in order to be a part of the community again sometime soon. I think the numbers we're seeing every day, while they're a bit discouraging, they are discouraging compared to some other states. You know, we feel not bad about the numbers, as bad as we might otherwise feel. And I think it was Yogi Berra who said, it ain't over till it's over. Well, it ain't over till it's over. But stick with us, stay home, stay apart. We'll get through this together. Thank you.